My second question is, how do you think quarantine, especially in those who lived in urban environments, were impacted in their mental health?
I think that quarantine has been really hard for people, and it is the thing we had to do to stay safe physically from COVID. But we're social beings. We need human connection to foster a sense of belonging, to thrive. And so, suddenly taking that away and confining, where you can go, I think has been particularly hard. It's even harder when you have a lot of people that live in your house, and suddenly, there's nowhere to go to escape the other people in your house. And we know that, in low-income communities, for example, households are more likely to be multi-generational. They're more likely to have more people living in a smaller space. And so, those stresses, I think, can be hard on mental health as well. For me, it was hard to be home with my 3 kids while also trying to work full time. And so there's, for working parents who had to continue working either in the home or out of the home, but who suddenly didn't have any childcare, no daycare, no school to go to, that is another added layer of stress, particularly for younger and sort of elementary age kids that can't be left alone. One of the things I tried to do early on in the pandemic is make sure we got outside as much as possible. Pretty early on, we knew that outside was one of the safer places to be, aside from just staying at home. And so we walked to local parks a lot. But that also speaks to the importance of having parks that you can go to. And a lot of neighborhoods don't have high quality park space to go spend time outside.